Despite affecting over 1.5 million people in the U.S. alone, systemic lupus erythematosus, or simply lupus, is a relatively unknown disease. About 90% of those living with lupus are female, and most are diagnosed between the ages of 13 and 50. Lupus is a chronic autoimmune disease, which means the body's defenses lose the ability to tell the difference between foreign bodies, such as bacteria and viruses, and healthy tissue. It's not a contagious disease and has no relation to cancer, HIV, or AIDS. Lupus is a disease of flares and remissions, flares being periods of active disease and remissions being periods of health. The flares can last anywhere from days to years. Because the body cannot tell the difference between foreign bodies and healthy tissue, there are many organs in the body that are affected by lupus. The disease progression in every patient is different, but the most commonly affected regions are the joints, the kidneys, and the skin. Other organs that can be affected are the liver, the brain, the lungs, the pericardium, which is the membrane enclosing the heart, and the heart itself. Symptoms associated with lupus can be visible or invisible. Unlike some other diseases, it can be difficult to look at somebody and know whether or not they have lupus. Some visible symptoms that help guide rheumatologists to a diagnosis include rashes, hair loss, and Raynaud's phenomenon, which is extreme vasoconstriction or shrinking of the blood vessels in the digits. And the digits, or your fingers or your toes, end up purple or white and very cold and in pain. The most common rash is the malar rash, which is a red rash that spreads in a butterfly shape over the nose and onto the cheeks. And this rash was actually one of the hallmark symptoms, and is considered the hallmark symptom of lupus, and helped give lupus its name back in the 15th century. Unfortunately, the specific cause of lupus is still unknown, and there's no one test or specific test that can identify whether or not a patient has lupus. There's no cure for lupus at this point, but there are treatments used to help manage the disease. And these medications can be as severe as chemotherapy or as benign as Advil or ibuprofen. The scientific community's understanding of lupus has grown in leaps and bounds over the past 50 years, but there is so much more to learn, and hopefully new research will be done to advance our knowledge and potentially bring some relief to those living with this debilitating disease. Thank you.